A study was just published in the Journal of the American Heart Association where we found bacterial DNA inside cholesterol plaques, not just around the plaques, but actually in the plaques in our arteries. This could potentially change how we think about cardiovascular disease in a really big way. So today we are diving into just that, how our oral and gut microbiome are related to cardiovascular disease. To be clear, this isn't just fringe science. This was a legitimate study, and we are going to get into all of the details about this because this is really big news. So we are going to talk more than just about cholesterol, even more than just inflammation in the arteries, which we've talked about before, but really diving into the oral microbiome and how that bacteria might be ending up in your cholesterol plaques. So welcome to the Natural Doctors. I'm Dr. Katie Dinello along with Jennifer Stagg. And before we get into that, our big topic, let's spend a couple minutes talking about what we are seeing in clinic these days. So for you, anything coming to mind, cholesterol related or not?
Yeah, well, so interestingly, like with this topic, and we had planned to talk about this today, I was at the dentist this morning and
yeah, it's good timing.
Yeah, of course. And I'm like, okay, the oral microbiome, and they're asking about what my health goals were, dental health goals. And we had a conversation about, whole body health, dental health and the body. And my dental hygienist was just saying like, oh, okay, years ago, they were just like, okay, up here is a separate thing from the rest of the body. And now we know there's so much more to the story. And she was talking about a couple of different cases that they had seen that were like clear examples. And certainly, there's lots of research, not just this study we're going to talk about today, but there's plenty of research relating heart health to oral health.
Yep.
But she relayed a patient who had diabetes and also had this tooth abscess and was resistant to having the tooth treated. And they, continue to work on this patient and, encourage her to have that tooth abscess treated. And finally, once the abscess was treated, her diabetic numbers improved dramatically. Yeah. So there's that metabolic health related issue there. And then a second story then she relayed was about a younger patient in his mid-20s, otherwise healthy, practicing good oral health, and his gums would bleed often. So, and he was flossing, doing all the right things, and they were sort of perplexed about, well, what's going on here? And then this young man had an appendix rupture and was, septic. And, apparently was quite ill. And then he came finally, after he had recovered from that, came back and his bleeding in the gums completely resolved.
Wow.
So then we know there's this sort of, inflammation, immune activation. They were sort of, we're having a conversation about like, well, what was that?
Right.
And that's inflammation.
Yep.
Right.
And the immune system, right?
Because that's chronic infection, some subacute infection there, and the immune system activated.
Yeah. Gosh.
So pretty fascinating.
It's
right?
really, really fascinating, right? And we are definitely at the point now where, when I first heard about this, like, maybe 5-6 years ago, this idea was introduced to me where there's a connection between our oral microbiome, our oral health, bleeding gums, and then systemic wide inflammation. I kind of was like, all right, I have enough to manage as a doctor, especially in like the holistic functional medicine health space. I don't have time. Like that's what a dentist is for,
Go see your dentist,
yes.
which we
make sure. It's like in our annual exams, I'm like, do you see a dentist? Great, good. But now we're at the point where I am asking pointed questions about that. Like, do you brush your teeth? Do you floss your teeth? Are you seeing your dentist? Have you had cavities filled? What does the dentist say about your teeth? Do your gums bleed when you floss, right? Because it really matters. So yeah, interesting stuff. And as we'll get into it in a little bit, we've got some really good studies on this now. Keep
So
things
anything, any specific clinical cases this week that you wanted to talk about? Or?
Definitely. So, it's kind of this picture that I see repetitively of, people who are, maybe in their late 20s to mid 30s, right? So on the younger side, where cholesterol levels are not exactly elevated yet, because that age range, you can kind of still ride what you did in childhood. Like your body is still compensating really well compared to, a 50 or 60-year-old patient. They might not be compensating as well if the lifestyle factors aren't there. Yeah. So these patients, they're kind of compensating well. Those cholesterol levels, maybe they're barely borderline, but it's nothing red flag, right? That total cholesterol, that LDL, it's not like, oh man, this is high. We really got to look into this. But we've got kind of that, that inflammation marker is a little bit elevated, right? Those triglycerides are a little bit elevated. Insulin is starting to creep up there, fasting blood sugar. So it's this in-between picture, right? And I see this constantly. And these are the patients where if they go to their primary care doctor is not saying a single thing to them. They're looking at their labs and saying, check, check, check. Right. You're super healthy. You feel good. Oh, you're a little tired. No big deal. Whatever. Like, you're good. Where I see these patients and I think if we do nothing, you are going to feel miserable and have pretty significant, potentially, cardiovascular disease in 10, 15 years.
Right, because this is what we think about, right? Is that cardiovascular disease and the dysfunction that happens in the arteries. That's many years, decades in the making, right?
Exactly.
So the intervention needs to start much earlier.
Yep. And same like on our Instagram and TikTok over there, we've been doing a series all about insulin resistance, blood sugar management. And something we've been harping on is your insulin might be high for 10 years before you even go on to get diabetes, but like 10 years of opportunity to prevent that. And so I think cases like this just really highlight the true preventative medicine that we practice of, okay, we're digging deeper. We're trying to really be optimal here so that you can prevent worse outcomes in the future. So
yes, 100%.
Yeah.
Absolutely. So important and to get that information out there.
Yeah. And then kind of similarly, talking about the gut, it's also, we see that with patients of they come in and we're like, how's your gut health, right? And most people are like, fine, especially in that age range, like, oh, fine, And I'm like, do you have a bowel movement every day? Well, most days, but maybe every other day. Yeah, or I don't know. That's when you're like, oh, red flag.
Okay.
Hold on.
I don't know.
Yep. Oh, maybe I feel a little bloated, maybe a little bit of mucus in my stool, right? Things like that. Those symptoms are not normal. We should be having well-formed bowel movements that are easy to pass every single day. We shouldn't be skipping days. And again, like those are early signs that we have dysbiosis in our microbiome. So again, that now we know is affecting cardiovascular disease. So even if you're teetering on that line, your body can't compensate like that forever.
Yeah, absolutely. Yep. And this is something we've talked about in earlier episodes, and we've done shorts and things on this, but TMAO is a really cool test that you can have easily done, a blood test ordered through, a local, your regular lab like Quest. And that test is going to tell us if there's bacterial sort of byproduct getting into your bloodstream, and that can increase your risk of cardiovascular disease pretty significantly. So it is something that we are pretty, routinely adding on for a lot of our patients to really have an objective measurement to look at gut health in relationship to cardiovascular health.
Yeah, exactly. Cool. Do you want to dive into this article?
Yeah, we should. Yeah,
let's do it.
Because we're going to, how we get going talking and then we'll run out of time.
Exactly.
So this was an interesting study. I can start out, and it was published, in 2025. And this was a study that was done in Finland, and they looked at these patients that had died of some sort of event. And this is something that, by law is required in Finland. They have to then do autopsy and figure out like what happened to these patients. So then they took the patients that had died of an MI or a heart attack, and then examined during autopsy the composition of the plaque. And this is where they found that a large percentage of these patients had this specific type of oral bacteria in the plaque, and it was encoded in what's called biofilm. So any of you out here who are on, doing your own research, looking at gut health, you'll run into biofilm and biofilm disruptors. And so that's basically just like a matrix that sort of sets up and sort of protects that bacteria so it can basically thrive, right? It's a protective mechanism. But there was biofilm coated basically a bacterial in the plaque itself. From the oral cavity, right?
Yeah. So this is like twofold. Number one, we're finding specific strains of bacteria that correlate with the bacteria in our mouths, right? So that's the first thing. The second surprising thing that they didn't necessarily expect to find was that, these bacteria were in this biofilm, which is a hard concept to kind of understand, but it's a protective mechanism so that that bacteria totally evades the immune system. So
so if you're taking antibiotics, that could be a way it can evade the antibiotic treatment. And we even think about that from a gut health perspective when we're using natural antibiotics. A lot of times we have to use formulations that have the ability to disrupt biofilm, and then that makes the treatment more effective from an antimicrobial standpoint.
Yep, exactly. So definitely really surprising. And the main bacteria they found here was Viridans streptococci. Viridans.
Yeah, Viridans. Yep.
We're not,
we're not microbiologists.
Exactly. So that's the one we're looking at, you guys. And then Prevotella was another one. We routinely measure Prevotella levels in stool samples in patients. So big connection there.
Right. That's and really that lives in the body, but higher levels are inflammatory, basically. So very routinely, when I look at microbiome testing, when I look at the results, a lot of patients that have some sort of inflammatory condition will have those high levels of Prevotella. So now we see this related to cardiovascular plaque.
Yes.
So this is starting to tell a very different story than the story that we've been told about statins and LDL cholesterol.
Yep.
So what is that statin doing for biofilm-coated plaque, right? Like, I don't think there's any proven mechanism of action that can help in that.
Not that we know of. Yeah, exactly.
So, I mean, maybe we talk a little bit here about, what's happening when plaque forms in the arteries, right? And the endothelial health.
Yes, exactly. And so what's interesting too is that in order for plaque buildup to happen, you have to have some amount of damage happening in the artery first, right? So, and that could be a red blood cell nicks the side of your artery, right? Like, perfect example. But, it is some type of insult or injury that's happening to that artery. And then the plaque is coming in as part of, we're repairing, right? Like a Band-Aid, right?
Yeah.
However, when that's happening more often and when there's already inflammation in your arteries, that response is kind of on overdrive. So you get more plaque buildup, more white blood cells, more immune mediators coming to that site of injury, and then that causes the plaque to build up more than it would so in a healthy artery. So again, that foundation, that health of the artery is so important because it sets the precedent for how the immune system is going to respond in repairing that vessel, right?
Yeah, so it sounds like, if people are thinking about this, and from my understanding is that comes a little bit more downstream, right? So if we were trying to really go after and target root cause, like we always are going after, we would think about, okay, what's damaging that artery to begin with, right? We're on the same line of thought there.
Definitely.
And then what is it? It's metabolic caused inflammation for the most part, right? Oxidative stress, damage, glycosylated protein.
Yes, yep, from insulin, sugar, carbohydrates. And what was interesting, the study also found that people who had more severe atherosclerosis, more plaque buildup, right, more cardiovascular disease in those arteries, had higher amounts of bacteria in the plaques, which was like a whole other layer of the study that was a little bit unexpected as well.
Yeah.
So, you know, it's about, yes, preventing the cardiovascular disease, but also if you have it, we can still prevent it from worsening, right? Which, according to this study, would obviously be beneficial. So super interesting there. But yes, so the first things first is we want to prevent the damage from even happening, right? And then we want to also prevent the immune system from overreacting, right? To prevent these large, you know, bundles of plaque from depositing there. So yeah, there's a lot going on in the arteries there.
Yeah. And so I guess, you know, what in terms of oral health, what are we recommending? What could help in this case? I think a big concern that we have would be the same sort of concept of what we covered in our shows, dysbiosis, right?
Yes.
A more inflammatory profiled microbiome. So this is a groups of bacteria that are not living in this lovely balance, right? And so then you end up with more of these more sort of inflammatory types of bacteria in higher amounts. And then inflammation, periodontal disease, and, you know, some of that bacteria can go directly right through the blood vessels in the mouth.
Exactly. Yeah. And it's the same principles we talk about with gut health, right? Where what we eat absolutely affects our oral microbiome. What's really cool is that nitric oxide plays a big role in this in a couple of different ways. So of course, nitric oxide is important for cardiovascular and vessel health because that's going to keep our arteries nice and wide, nice and patent to prevent blockages from happening. So important on that side. But also we have, you know, that nitric oxide production in our mouth. And that is based on the health of our bacteria in the oral microbiome. And this is a very simple test that we do in the office. We have the strips on our desk. It's really easy. You put a little bit of saliva, you put it on your tongue, and then based on the color of that strip, you can tell how high your nitric oxide level is. So really cool test and super important and valuable for that.
So so there are ways to measure it. There are even microbiome tests that you can do that are more sort of targeted to the dental community to really look at exactly what's going on in the oral microbiome. But yeah, you're right. What is causing this imbalance in the mouth bacteria in the first place? Diet is huge here, right? Sugar, processed foods. Then another thing that's very disruptive and people think they're actually helping their oral health is these really strong mouthwashes.
Yeah, like the alcohol-based ones.
Yeah, so they're going to really disrupt that microbial community. So if you think about, you know, just like our skin, if we're using antibacterials, you're disrupting your bacterial, you know, coat on your body in a not so good way. And then the same thing for putting oral antibiotics in, that can create all these problems in the gut. So mouthwash, I think, is often an over or underlooked cause of dysbiosis in the mouth.
Yeah, it is, right? Because again, you're not just wiping out the bad bacteria, you're wiping out all the bacteria, even the good stuff, which it's the same kind of concept as taking antibiotics in your gut, right? They're going to wipe everything out. So really important. We won't get too in the weeds here, but we also are really specific about the type of toothpaste we use too. So that's important.
And that's really actually a really good point. Is that a lot of those toothpastes are actually making your oral microbiome worse. Like the commercial toothpaste that we're not going to start listing names. Stay out of trouble.
But it is something that I go over with my patients, and I will put them on specific toothpastes, right? Not just for, you know, the bone and teeth health, right? But also, like, I'm putting patients on different mouthwashes, different toothpaste. You know, we use a couple of different products. If they're telling me they have bleeding gums, I'm like, oh no, like we take it really seriously.
So now another thing that comes to mind, and I did like look at this to see if there's any research on it, and it was the use of retainers, and I haven't found anything yet, but I only did a little kind of surface dig. But think about retainers and how people use retainers. And we just had a conversation with some of my mom friends last week about this. And retainers that, they're not being cleaned properly, right? So now you can get these hypersonic devices to really get that biofilm that's sitting on the retainers.
And it's there.
When they get like discolored, that's biofilm
the white
in
patches
there.
on there. Oh yeah.
So that potentially, so something to really, another thing to think about. We don't have any direct research linking these two, but it's kind of gross. Like you should clean your retainers better.
Clean those retainers. Okay, so let's talk about what people should actually do, right, to help prevent this, help treat this, and then hopefully we have some time to get into some listener questions here. So from an oral hygiene perspective,
right. So we covered a couple of things. Yeah,
brush your teeth, obviously.
Careful about mouth products, what you're selecting. Brushing, flossing.
Floss your
floss,
teeth.
floss.
Just do it. Floss your teeth. It takes 2 extra seconds. It's so important.
It's so critical because you're really just taking biofilm off your teeth, like teeth in the areas where you're not getting to it with your toothbrush or can't even get that off.
Yeah.
And then, yes, the really regular dental cleanings. And for some people, they may need to go a lot more frequently and not just the standard twice a year. They might be going every 3 months potentially.
Yeah. Exactly. From a nutrition perspective, making sure we are not eating a lot of simple carbohydrates. I talked with 4 patients today alone about rice. So many people are eating rice, you guys. And I'm not here to demonize any one specific food, but rice is so high glycemic, increases your glucose load. It's skyrocketing that insulin, right? So just easy on the rice, please.
Yes, 100%. And people come to terms with that when they wear a glucose monitor.
Yes,
that's
absolutely.
Really when the light bulb comes on.
Yeah. So making sure that we've got healthy blood sugar metabolism is important. And then, all of your other basics, right? An anti-inflammatory diet, making sure we're getting good sleep, omega fatty acids, these things lower inflammation. And that's, as we know, a huge part of the puzzle.
And then stress, the elephant in the room, nervous system regulation. Again, we've covered this. We'll do more episodes completely devoted to this, but huge issue here with a cause of inflammation that's nervous system and stress-induced inflammation.
Yeah.
And then, we should get a couple of questions in, right?
Let's do it. So this is an easy and quick one, but it's one that we get all the time. How do I know if I have inflammation, right? Couple of things. Number 1, do you feel inflamed, right? Like easy. Most people know, like either, yes, I feel inflamed. I've got joint pain. I feel puffy. I see it in my face, right? Or no, like I feel great, right? If you're saying you feel great, you probably don't have a lot of inflammation going on. But of course, we're going to take that a step further and we're just going to measure your markers. This is super easy, simple blood test. Anybody can order it. C-reactive protein.
Yes.
We really like a high sensitivity C-reactive protein because it's a little bit more specific.
Yeah. And that's such an easy test to run, widely available as well. Yeah,
exactly. A couple of other markers you can look at related to inflammation, ESR or sedimentation rate. That's a little bit more autoimmune focused. Fibrinogen. I used to measure fibrinogen a lot. I don't measure it a ton anymore.
Right, because you can capture with these other things.
Yeah, exactly.
But one thing to note, like just that, as you said, that sometimes we can get negative marker. So people can be inflamed and they don't show positive markers on the CRP and the SED rate. And so sometimes the way we conceptualize this is that it can be in the tissue space. It's not like circulating in the bloodstream. There could be other markers that we haven't tested, things like different sorts of prostaglandins, interleukins, and those could potentially be elevated, or fibrinogen, something like that. So just because you have a normal CRP, it does not rule out inflammation. It rules it in, but doesn't rule it out.
Good point. Yeah. Also, this has come up for me twice this week alone, is a significantly elevated ferritin level. So ferritin is a way that we look at iron. It's our iron storage form, but we come across this where it is just sky high, through the roof. I had a level of 600 today. So, it's high, and that tells us typically it's inflammation. Could be some other stuff, but usually at that level, we're dealing with inflammation there. Okay, great. Endothelial dysfunction. I get this question a bit, and we didn't fully talk about this. So what is endothelial dysfunction? Tell us, like, what is the endothelium?
Yeah, so that's basically just the lining of those blood vessels, and dysfunction, just like you would imagine, means things are not working properly in there, right? So that endothelium has this really, gel-like matrix in there, and the composition of that can basically change and can get out of balance. And nutrition is really important here, obviously, and that's the primary reason. Some different infections can result in a change in that matrix as well and cause this endothelial dysfunction. But it's a huge issue. There are various ways to measure that. We'll have to talk about that fully on another episode.
Yes,
I think we're basically out of time.
We are. We could do a full episode on the endothelium, but absolutely.
Yeah.
All right, everybody. Thank you so much for joining us. We hope you liked that episode. A totally different take on cardiovascular disease. But again, it's not fringe. This is legitimate science, and we should all be aware of these articles. So we are the Natural Doctors. Make sure you subscribe to our YouTube channel so you never miss an episode.
I'm your host, Kurt Barwis. Today, I have a very special guest, Dr. Andrew Lin.
Hello, and welcome to another episode of the Veterans Corner. My name's Chuck Wooden.
Decision for ourselves for this week, if we want to be made well.
Hi, welcome to the crack of dawn. It's Dawn Lombardi. I'm starting the painting. It's going to be the clips with some water. Love it.
He took me on the sets of Lost in Space, Batman.
Everybody has a story. What's yours? Until next time.
Nick Augustino right here at the East Side Restaurant. We always have the complete full dinner menu. Knockwurst, bratwurst, sauerbraten, potato pancakes, red cabbage, rice pudding, cream pies, all the desserts that Germany had to offer. I always do something different. Yes, I do. I brought seafood to the beer garden at the East Side Restaurant. East Side Restaurant, your German destination restaurant in Connecticut. Tiki-taka, hoy, hoy, hoy!